enrichment scheme. It's literally what they're doing, is printing money in the Treasury and giving it to insurance companies. That's their solution for healthcare. Enriching insurance companies that are the very people that are telling the American people which care they can get and not get. There's no chance for an American to go to the doctor of his or her choice. There's no chance for them to go get care. There was no chance for my constituent who lives near Fredericksburg, Texas, to go to MD Anderson to get care because she's on Obamacare, which can't go to MD Anderson. And if the cancer that I had when I went to MD Anderson came back and I'm on Obamacare as a member of Congress, I couldn't go to MD Anderson.
Oh yeah, you heard that right. A congressman, cancer survivor. Just told you he couldn't go back to the hospital that saved him, under the exact system his colleagues are fighting to protect. That's not politics. That's personal. We're breaking it all down today. The scheme, the numbers, and the response that proves they have no real answer. New here? Hit subscribe right now. Let's get into it.
What my Democratic colleagues are proposing is an insurance company enrichment scheme. It's literally what they're doing, is printing money in the Treasury and giving it to insurance companies. That's their solution for healthcare. Enriching insurance companies that are the very people that are telling the American people which care they can get and not get. There's no chance for an American to go to the doctor of his or her choice. There's no chance for them to go get care. There was no chance for my constituent who lives near Fredericksburg, Texas, to go to MD Anderson to get care because she's on Obamacare, which can't go to MD Anderson. And if the cancer that I had when I went to MD Anderson came back and I'm on Obamacare as a member of Congress, I couldn't go to MD Anderson because of the situation that my Democratic colleagues have put the American people in. Going around and preening that you're somehow caring for people more by giving them coverage for care that doesn't actually provide them care, while insurance companies get rich. $35 billion in subsidies in 2024 for people who didn't even use their plan.
All right, let me break this down. Roy isn't just venting. He brought the math. Insurance stocks up over 1,000% since Obamacare passed. 85 cents of every dollar insurers make comes straight from the federal government. And in 2024 alone, $35 billion in subsidies paid for plans people never even used. That's not healthcare. That's a money pipeline with a stethoscope on it. And Democrats want more of it. More subsidies, more printed money, more cash going to the same corporations that decide which doctor you're allowed to see. A woman near Fredericksburg, Texas, needed MD Anderson, one of the best cancer hospitals on earth. Obamacare said no. Not too expensive, not too far. Just no. Roy beat cancer. MD Anderson saved him. He said it himself. If it comes back tomorrow, he can't go back, under his own colleague's system, a sitting congressman, locked out of the hospital that kept him alive. That's not coverage. That's a wall with an insurance logo on it.
It's absolutely unconscionable. That is right. That is the correct word. It is unconscionable what we have done to the healthcare system, destroying it for the American people so that they can't get the care of their choice. That's what's happened. And now you hold the government hostage for 45 days and then try to come lecture Republicans about it when you've been holding the American people hostage to a broken healthcare system for 15 years. That's what's been going on. The fact is, Madam Chairman or Chairwoman, we are here today trying to proceed with, I think, reason, with 3 appropriations bills combined with a continuing resolution through January. After having tried with reason to fund the government through November 20th so that we could continue the debate on the various issues in question. But our Democrat colleagues refused to do it. And so now we've got the opportunity in front of us to extend, fund government at current levels, roughly flat, trying to stave off the inflation that is the direct consequence of the massive amount of government funding that has been going on by both sides of the aisle, but heavily being promoted from my colleagues here on the other side of the aisle, who want us to throw another $1.5 trillion at it. That's literally what they were saying. It's not a solution. That's just printing more money while trying to go run campaign ads while you shut the government down for very clearly and obviously political purposes. I yield back, Madam Chairman.
Madam Chair, I wish the gentleman had that passion condemning the $40 billion bailout of Argentina, the right-wing cuckoo clock in Argentina. I wish he had the passion to condemn that.
Mr. McGovern and Ms. Scanlon, you're recognized.
Democrats have run on health care for 15 years. 15 years of promises. 15 years of campaign ads. 15 years of standing at podiums telling you they're the ones who care. But every year, insurance companies get richer and patients get fewer options. Premiums go up. Deductibles go up. The list of doctors you're actually allowed to see gets shorter. That's not a coincidence. That's the design. Think about what that really means. They didn't try to fix it and fail. They didn't have good intentions and make mistakes. They built it this way, deliberately. A system where you pay in every single month. Insurance companies take their cut at every single step. And Washington stands at a microphone and calls it compassion, calls it progress, calls it caring for the American people. When you hear, "we need more subsidies," stop and ask one question. Who actually gets the money? Not you, not your family, not your doctor. It goes to the company that decides whether your doctor is even on the approved list in the first place. The company that looked at Roy's constituent in Fredericksburg, Texas, and said, "MD Anderson, not for you." The company that would look at Roy himself, a sitting United States congressman and cancer survivor, and say, "Sorry, not covered." And now they want more money for that exact same system. More of your tax dollars, more printed money, more stock price gains for corporations that already went up 1,000% on the back of this law. Roy called it an enrichment scheme. The numbers back him up. 15 years of data backs him up. Every denied claim backs him up. Every blocked referral. Every patient turned away from the doctor who could have saved them. That backs him up too. The question isn't whether the system is broken. Everyone can see it's broken. The real question is whether anyone sitting in Washington actually wants to fix it, or whether they're too comfortable with the way things are. Simple question. Do you believe the current healthcare system actually works for regular Americans? Yes or no? Drop it below. Subscribe if you haven't. Hit the bell so you don't miss the next one. Stay right. Stay strong. See you on the next one.